From the medical library. Prior to your upcoming TBL about carcinogens and lung cancer, we wanted to send a quick video to help with your preparation. In this TBL, you will be researching whether or not a particular substance or practice promotes the development of lung cancer. For your research, I would recommend starting at our self-directed learning guide. You can find this guide on the medical library homepage. Just click on Research Guides and scroll down to find it in alphabetical order. Self-directed learning resources. Resources are arranged in this guide by type, and hopefully many will be familiar to you. Aside from the resources themselves, there is also a tab with an information evaluation checklist. This checklist can be useful for considering the validity, accuracy, and appropriateness of sources used in your research. For this exercise, I would recommend starting with one of the 3 resources included in the textbook section: Access Medicine, Clinical Key, or LWW. If you need an overview of these resources, we have specific videos for each one. Access Medicine is going to have a lot of great textbook resources to provide broad overviews of your topics, but I wanted to show you some filters that might be helpful in Clinical Key and LWW. For Clinical Key, I'm going to start with a quick search for asbestos lung cancer. You can use whatever your substance or practice is. I'm going to click on search, and while it thinks, I'll mention that Clinical Key has a variety of different sources, from journal articles to books, clinical overviews, and these are the filters that we would recommend you think through. A basic search is going to give you some broad information. There's a clinical overview about lung cancer, there's a chapter excerpt about asbestos, and from reviewing them previously, I think that you may have some good information there. But if you are looking for more focused information, consider the option for narrative reviews, or for books, or finally for clinical overviews. And just to select clinical overviews, maybe we'll see one that we have already seen, but instead of a chapter excerpt about asbestos, there's a clinical overview for asbestosis. So as you can see, the filters are going to provide a little bit more nuanced results that will hopefully start helping you think through the gaps in your knowledge. I'm going to go back to the self-directed learning guide and go to LWW. Again, there are going to be some broad information here if we do a search for asbestos. And there will likely be some helpful information that you find just by doing a basic search. There are a lot of images of asbestos, and if you keep scrolling down, there are going to be textbook content related to asbestos-related disease, exposure, what it causes, types of asbestos, etc. But something that is going to be useful within LWW are the subject filters, so you can think through which ones might be appropriate for your topic. I think for many of you, the filter for pathology and pathophysiology is going to generate some more detailed sources related to your topic. And we saw some of these when we scrolled down, but using the filter is going to help make your search a little more efficient from the beginning. So that is LWW. Just looking at the self-directed research guide, there are other resources that you can consider. I'm going to scroll down Up to Date could be a good source to start with, just some broad point of care information. PubMed is another one that you may want to consider. And specifically, we would recommend looking into PubMed clinical queries. Ms. Mills has prepared a short video specific to the PubMed clinical queries search, and that video is linked here. It should also be linked in Canvas, so we hope you take the time to check that out to consider how that search can be useful in this upcoming TBL. Thank you for your time today. Please feel free to contact us for assistance prior to class. We will also be available during the TBL itself, so we will see you then.